Let's still stick with health matters. And the Ministry of Health has launched the National Cervical Cancer Elimination Action Plan 2026 to 2030, a 5-year strategy aimed at eliminating cervical cancer in the country. According to the ministry, Kenya records about 5,845 new cervical cancer cases each year, and of those cases, approximately 3,591 women die annually from the disease. The action plan seeks to reverse this trend by strengthening prevention, early detection, treatment, and long-term follow-up. Our Health and Science reporter, Chebet Birir, has more.
Sidis Wandera, a widow and cervical cancer survivor, has had her fair share of pain and struggle with cancer since 2021.
When the gynae tried to do a physical examination, I really blamed. So it appeared like I had a very big growth that had not been noticed.
Through her experience, Praxidis highlights the importance of early screening and the need to invest in cancer equipment and medical devices that are friendly to cancer patients.
If we can be able to get people to look into an innovation that can be able to improve these apparatus for brachytherapy, to be a very great achievement for many women. Because I know many women, when they start brachytherapy, they will do one session, others, and stop because of their uncomfortability.
In his keynote address during the launch on Thursday, Health CS Aden Duale highlighted key policy and reforms, including Kenya's transition to a single-dose HPV vaccination schedule, expansion of HPV DNA testing, introduction of self-sampling to increase screening uptake, and deployment of digital health innovations to extend services to women in all 47 counties.
Together we can and we will eliminate cervical cancer from our country.
We're training cancer survivors, caregivers, and stakeholders and allies to be able to package the messaging that cancer is not a death sentence.
The plan is designed to drive progress towards the World Health Organization's global 90-70-90 target, which aim to ensure 90% of girls are fully vaccinated against HPV by the age of 15, 70% of women are screened for cervical cancer by age 35 and 45, and 90% of women diagnosed with cervical cancer receive timely and effective treatment.
It's going to cost 1.2 billion in terms of health system strengthening interventions for our action plan to be implemented over a period of 5 years. But our target is to reach this level, 90-70-90 goals. Some of the challenges we have, people are not taking up the services. Some do not know about them, but many people know about these services, but there is a breakdown in the knowledge to action.
There are financing gaps that make most of these countries not able to scale cervical cancer screening and treatment across all populations, across all regions. So as Health Systems Insights, even as we are developing this action plan, we've worked closely with the Minister of Health, providing a technical support and advisory on the best way you can be able to use the ongoing reforms within the health financing space in the country through implementation of universal health coverage.
Globally, cervical cancer is the fourth most common cancer among women, with approximately 660,000 new cases and 350,000 deaths each year. Africa accounts for nearly a quarter of global cervical cancer deaths. Although the disease is largely preventable through human papillomavirus vaccination and early screening, many women continue to be diagnosed at advanced stages due to gaps in access to services. Chebet Birir, KTN, Nairobi.
President William Ruto today met at